The brain is a powerful organ. It controls our thoughts, our emotions, and even our physical sensations. But sometimes the brain can send signals that make us feel physical symptoms, even when there's no underlying medical cause. This is the heart of conversion disorder, a fascinating and often misunderstood condition. Conversion disorder, also known as functional neurological symptom disorder, is a condition where psychological stress manifests as physical symptoms. Imagine, for example, a student so overwhelmed by the pressure of an upcoming exam that they suddenly lose their vision. While the vision loss is very real to the student, medical tests reveal no damage to the eyes or optic nerve. This disconnect between experienced symptoms and physical reality is a hallmark of conversion disorder. The symptoms are not fabricated, they are very real to the person experiencing them. The challenge lies in understanding that the root cause is not a disease process, but rather the brain's response to stress, trauma, or other psychological factors. The symptoms of conversion disorder can vary widely from person to person. Some might experience paralysis or weakness in a limb, while others might have seizures, blindness, or difficulty speaking. The key is that these symptoms cannot be explained by a neurological or medical condition. The human body is incredibly complex, and the interplay between mind and body is not always straightforward. In conversion disorder, the brain, in response to overwhelming stress or trauma, converts psychological distress into physical symptoms. It's as if the mind is saying, I can't handle this emotionally, so I'm going to express it physically. Imagine a soldier about to be deployed to a war zone. The fear and anxiety become so intense that they develop paralysis in their legs, preventing them from deploying. And while the paralysis is real, there is no underlying nerve damage. The brain, in an attempt to protect the individual from the perceived danger, has created a physical manifestation of their emotional distress. The symptoms of conversion disorder are not intentionally produced or faked. The individual is not consciously choosing to experience these symptoms. Rather, the symptoms arise involuntarily and unconsciously as a response to underlying psychological distress. It's important to remember that while the symptoms themselves may not have a direct medical cause, the suffering they cause is very real. Individuals with conversion disorder need compassion, understanding, and appropriate treatment to address the underlying psychological factors contributing to their condition. Recovering from conversion disorder is a journey that involves addressing both the physical symptoms and the underlying psychological factors that contribute to the condition. The first step is often a comprehensive medical evaluation to rule out any underlying medical conditions that may be causing or contributing to the symptoms. Once it's determined that conversion disorder is the likely diagnosis, treatment typically involves a combination of psychotherapy and physical therapy, as well as deep TMS with brain pathway therapy. Now, psychotherapy, particularly cognitive behavioral therapy, CBT, can be very effective in helping individuals understand the connection between their thoughts, feelings, and behaviors, and how these factors contribute to their physical symptoms. Physical therapy, on the other hand, focuses on addressing the physical limitations caused by the symptoms. For example, if someone is experiencing paralysis in their leg, physical therapy can help them regain strength and mobility. However, the connection of the pathways must be established also, or we could get failure to improve and discouragement. Recovery from conversion disorder is possible, and many people go on to live full and meaningful lives after receiving appropriate treatment. It's essential to approach this condition with empathy and understanding. Remember, the symptoms are very real to the person experiencing them, even if there's no identifiable medical cause, such as a visible lesion. And there is a cause for this condition, and it is that the brain is using the wrong system to deal with another problem. Shaming or dismissing their experience will only exacerbate their distress and hinder their recovery. By addressing the underlying psychological stressors, learning coping mechanisms, and engaging in appropriate therapies, individuals with conversion disorder can reclaim their lives and experience lasting relief from their symptoms. Early intervention and a supportive environment are crucial for a positive outcome. With the right support and treatment, individuals with conversion disorder can overcome their challenges and live fulfilling lives.